Hi, I'm Shuai. I made this to help us in our final exam that's coming up in a couple of weeks. And today I'm going to be doing neoplasia. So neoplasia can be categorized into two types. One is benign and one is malignant. Benign means that it's localized to one side, whereas malignant is actually can be spread out through all different parts of the body. Malignant also composed of two types. One is sarcoma, which means it involves the mesenchymal cells, and one is carcinoma, which involves the epithelial cells. Gross leaf neoplasia can be categorized into 7 types. One is a polyp. I don't know if you can see that, the polyp. And capillary, it means it's got like little polyps on one polyp. Nodular, lobular, cystics. These are all benign tumors, whereas this one is infiltrating and ulcerative. These are they do not have a clear edge around them, which means they actually spread through all out to different parts of the body. So for this exam, we need to know which ones are benign tumors and which ones are malignant tumors. I can never pronounce that. But benign tumors are well-differentiated cells, which means they actually resemble the cells of origin. They're slow-growing, and they usually have a capsule around them, and they're localized to the site of origin. Patients present with no fever, and on a slide they do not all have a few. No, actually, I changed that. I don't know if patients have fever or not, but on the slide they have a few or no pathological mitosis. Whereas malignant tumors, they're poorly or completely differentiated. That means that the cells under the slide, they do not look like anything under the anything like the cells of origin. So they grow faster. Well, how do they grow faster? Well, it depends on the blood supply, the hormonal factors that's acting on the tumor, and the emergence of the new cancerous cells. They invade through the surrounding tissues and they metastasize to distant sites. They're the greatest at destruction, and they cause bleeding and infection. Reoccurrence of malignant tumors are quite often, and many might present pathological mitosis. So metastasis. I've got 2 examples of benign and malignant tumors. This is the tumor, the exogenous tumor of cervical cancer. Actually, this is not. Well, okay, this is cervical cancer. Can't tell where then. And this is definitely a tumor that has gone. That is actually a malignant tumor, but that has not been metastasized, because that you can tell that's like a primary site. Whereas this one, the tumor, you can see all the necrotic sites where it invades the whole bits of the stomach, which means that this is actually a primary site for carcinogenesis, malignant metastasis of the cancer cells. So we also have to know what metastasis is. So metastasis is development of secondary tumor implants in distant tissues, depending on the size, the type, and the degree of differentiation of tumor. There's 3 ways of metastasis. One is seeding. This is when the tumor invades the body cavities and it breaks off and implants on the perineal surfaces, for example, the ovarian cancer. The second way is the lymphatic spread. Tumors can be spread through local lymph nodes, moves through the thoracic duct, and empties into the subclavian vein. So eventually it gets into the blood circulation anyway. And the third is the blood supply spread. The veins are actually easier to invade than arteries. Livers and the lungs are the most common metastasis destinations.